Hi. All right, so going live for a second time today to do part 2 of talking about what is low energy availability or RED-S. So sometimes I pronounce it RED, sometimes I pronounce it RED-S. Not really sure which one's correct, so I'm just going to go with it. So first off, I want to talk a little bit more about what is low energy availability. So me and Karia talked a little bit about her experience this morning as an athlete and the symptoms of RED-S that she experienced along with disordered eating. So what is it exactly? So basically RED-S or low energy availability is when what you're taking into your body or eating through food is not enough to compensate for your body's needs and or your physical activity. This can be more common in active women and athletes simply because when you exercise, it's basically like an automatic withdrawal to your energy bank account, right? If I'm choosing to do an hour run each day, that energy is just getting taken right out of my body's energy bank account, I like to call it. It's not even seeing that energy. It's not even having a choice of what it's being used for, and all it has left to utilize to function all of the body's systems is what is remaining in that energy bank account. Okay, so I hope that was a helpful thing. That's why it tends to be more common in athletes and active women, but I always think it's also important to remember that this is not necessarily something that only happens in active women and athletes. So that's basically a little bit what it is. Symptoms that happen with low energy availability are going to be the most common ones I see are irregular or missing periods in active women or athletes, GI issues like bloating, gassiness, maybe a little bit of constipation and or diarrhea. And then also another one is just fatigue or not seeing progress or gains from all the training that you're doing. Those are the most common ones I see, but it's also important to note that depending on the level of low energy availability that's going on, you can also see a lot of anxiety, lack of concentration, lack of memory. It really impacts all systems in the body, and depending on the severity and the level or how long it's been going on for, the more systems that it's going to impact. So the top 3 points that I like to remind people about that I think is where things get the most confusing for people is number 1 is this does not have to happen along with an eating disorder or disordered eating. You can be having low energy availability issues and have a completely healthy relationship with food. Obviously, disordered eating or an eating disorder is going to put you at a higher risk for not meeting your nutritional needs and for there being a mismatch between what your body is getting and what your body needs. But it can also happen as a result of you being active, you training for something, you just having a really busy lifestyle, forgetting to eat meals, missing meals. Maybe you are looking to lose weight or something, so you're been functioning in a calorie deficit for a while. All of these things can lead to low energy availability issues and be totally separate from an unhealthy relationship with food. So I always think that's such an important thing to remind people of. The next one is that we can be in a state of low energy availability and be at a stable weight and not feel as necessarily hungrier than what we are consuming. The reason for this is because hunger and weight are learned behaviors by the body. So if you've been eating a certain way for a while, maybe my needs are 2,400 calories per day, but I've been eating just naturally, let's say like 1,800 calories for the past 2 years, my weight is no longer going to change and my hunger signals are no longer going to tell me I need to eat more because they've now adjusted to my new eating pattern. This is not reflective of what my body needs. This is just reflective of what my body is used to getting. So sometimes we need to kind of train the body back to expect what the needs actually are. The last thing I like to remind people about when it comes to low energy availability is everybody's experience is different. Genetically, we are going to be more susceptible to some reactions of low energy availability than others. I've seen women who have struggled with low energy availability for years. They have always gotten a normal period, but maybe they're constantly struggling with a lot of gas and bloating and other symptoms related to it. I've seen the opposite. Their digestive tract is totally fine. They have no complaints, yet they haven't gotten a period in 2 years. Obviously, one of the biggest concerns with not getting a period is its impact on our bone health long term. I've seen women who, get abnormal periods for 5 years because of low energy availability issues, and their bone health when they get a DEXA is totally fine. They are just happen to be genetically protected in that area. I've also seen those who've experienced low energy availability issues for only a short period of time, maybe only a year, they've had a wonky or missing period, and then their bone status is not great. So it's really important to kind of just look at your individual health. Look at what is not necessarily seems to be working in your body. I know my experience with this, a lot of things seemed fine, but my immune system sucked. And so that was kind of a signal to me when I started learning about low energy availability issues that, okay, something's a little off here. Like maybe I feel like I'm doing everything correctly, but clearly my body is trying to tell me that something is not enough. So it's really important to kind of not just look for one symptom, but look at the broader range of issues that can occur and really look into kind of what is going on in your body. Are you noticing anything that just doesn't seem to be functioning optimally and you cannot identify another reason for it? That's one last point that I wasn't going to talk about today, but that I feel like is super helpful to remember is that if we can go to the doctor because of these weird symptoms, and they're going to run lab work and they're going to do a physical exam and they're going to check to see like what could be causing this. But if they're not finding any reason for it, then that is often kind of when we need to start looking at low energy availability issues or RED-S. Unfortunately, there's not really one test that we can do to help indicate this is what's going on. It's really a diagnosis after a process of elimination. We are identifying nothing. We're kind of looking at eating habits and exercise habits, and that's more so signaling that this is likely the cause of those physical symptoms. Again, also, I'm talking a lot about the clinical issues that occur as a result of low energy availability, but it's also really important to note that there's a lot of negative performance effects too. When you're not fueling your body enough, when it doesn't have optimal energy stores to utilize on a daily basis, you're going to feel slower. You're going to feel more sluggish on your feet. Hand-eye coordination, concentration, focus while you're training, all of these things are going to be negatively impacted. So if this is something that you feel like you've struggled with or feel like could potentially be going on for you, what should you do about it? So the first thing is if you're noticing a clear clinical symptom, like I mentioned in terms of GI issues or period issues or really low energy levels, always go to your general practitioner first, just do a set of lab work, kind of eliminate any of the big things that could be going on. Next is be honest with yourself. Like I said, you can have a healthy relationship with food, but still not be optimally fueling your body. There's a lot of bad nutrition advice out there that is masked as good nutrition advice. Be honest with yourself. Do you feel like there's a gap? You don't have to answer yes or no, but just kind of asking yourself, do you feel like there's a gap between what you're doing for your body and what you're doing on a day-to-day basis and what your body actually needs? The next is if you've kind of gone through these routes and you still feel like you need to kind of investigate a little bit more, talking to a registered dietitian who is well versed in RED-S or low energy availability issues and knows what could be going on and what to look for. These are my top 3 pieces of advice if you feel like this could be happening to you. And as always, you can always DM me with like questions or just maybe a symptom you've noticed to see if like maybe it's worth going to through these steps for. So if you have any questions, as always, drop them in the comments. I'm going to put a copy of this video in my IGTV, but I hope it was a helpful recap for you.